Trolamine salicylate is commonly used to relieve minor muscle and joint pain, such as that caused by arthritis, backache, or sprains. It is classified as a salicylate drug. When using Arthricream cream, it's important to follow the directions on the product package. If you have any questions, be sure to ask your doctor or pharmacist. This medication is meant for use on the skin only, and should not come into contact with your eyes, inside your nose or mouth, or inside the vagina. If this does happen, make sure to flush the area with plenty of water. You can apply the medication to the affected area no more than 3 to 4 times a day, rubbing it in gently and thoroughly. After applying the medication, be sure to wash your hands, unless you are using the cream to treat your hands. Avoid applying this medication on broken or irritated skin, and do not bandage or tightly wrap the affected area, or apply heat to the area, as this may increase the risk of side effects. If you have any concerns, it's best to ask your pharmacist for more details. If your condition lasts for more than 7 days, gets worse, or keeps coming back, make sure to inform your doctor. And if you think you may have a serious medical problem, it's important to seek medical help right away. If your doctor has prescribed Arthricream cream for you, it means that the benefits of using this medication outweigh the potential risks of side effects. Most people who use this medication do not experience serious side effects. However, if you notice any of the following serious side effects, stop using the cream and contact your doctor immediately: blistering, peeling, redness, or irritation at the site of application, nausea, vomiting, or ringing in the ears. While very rare, a serious allergic reaction to this cream is possible. If you experience symptoms such as rash, itching, swelling, especially of the face, tongue, or throat, severe dizziness, or difficulty breathing, seek medical help right away. Remember that this is not a complete list of possible side effects. If you notice any other effects not mentioned here, it's important to speak with your doctor or pharmacist. In the U.S., you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using Arthricream cream, it's important to talk to your doctor or pharmacist if you have any allergies to Trolamine salicylate, aspirin, or other salicylates. This cream may contain inactive ingredients that could cause allergic reactions, so it's important to discuss this with your pharmacist. It's also important to inform your doctor or pharmacist of your medical history, especially if you have asthma or nasal polyps. If you are planning to have surgery, it's important to let your doctor or dentist know about all the medications you are using, including prescription drugs, non-prescription drugs, and herbal products. Arthricream cream is similar to aspirin, so it's important to not give this medication to children and teenagers younger than 18 years if they have chickenpox, flu, or any undiagnosed illness, or if they have recently received a vaccine. In these cases, this cream may increase the risk of Reye syndrome, a rare but serious illness. If you are pregnant or planning to become pregnant, it's important to talk to your doctor about using this medication. This cream may harm an unborn baby and cause problems with normal labor and delivery. It is not recommended for use in pregnancy from 20 weeks until delivery. If your doctor decides that you need to use this medication between 20 and 30 weeks of pregnancy, you should use the lowest effective dose for the shortest possible time. You should not use this medication after 30 weeks of pregnancy, so it's important to discuss the risks and benefits with your doctor. It is unknown if this product passes into breast milk, so it's important to consult your doctor before breastfeeding. When using Arthricream cream, it's important to be aware of potential drug interactions that could impact how this medication works or increase the risk of serious side effects. To minimize the risk, it's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It's crucial to consult with your doctor before starting, stopping, or changing the dosage of any medicines. This will help ensure the safe and effective use of Arthricream cream. If Arthricream cream is swallowed, it can be harmful. If an overdose occurs and serious symptoms such as passing out or trouble breathing are experienced, it is important to call 911 immediately. Otherwise, contact a poison control center as soon as possible. In the U.S., residents can call their local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Make sure to attend all your medical appointments and any scheduled lab tests while using Arthricream cream. This will help your healthcare provider monitor your progress and make any necessary adjustments to your treatment plan. If you forget to apply the Arthricream cream at the scheduled time, apply it as soon as you remember. However, if it is almost time for your next application, then skip the missed dose and continue with your regular schedule. Do not apply double the amount to make up for the missed dose. It is important to store Arthricream cream at room temperature and away from heat. Be sure to keep all medications out of reach of children and pets. Do not flush this cream down the toilet or pour it into a drain unless specifically instructed to do so. When the cream is expired or no longer needed, it should be properly discarded. It is recommended to consult your pharmacist or local waste disposal company for guidance on how to dispose of the product. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.